Hi, everybody. This is Coach Ryan, and I'm here to bring you another episode um, during our veterinary professionals series. And we have a very experienced veterinary assistant here with years, and she has so much talent. Olivia, thank you for joining us today.
Hi, no worries. I'm happy to be here.
So, tell me a little bit about where you're from and what inspires your love for animals.
Yeah, so I'm from the Bay Area. I've grown up here. I've lived here my whole life. Um, I from the time I was little, we've always had pets in my house, and um, like from the time I was 4, I told my mom I wanted to be an animal doctor. So I think it's just kind of like the standard way that a lot of people in this field grow up. Like we grow up animal lovers. We've had some sort of pet or animal experience um, from like childhood that makes you like really comfortable and kind of gives you an indicator that this is what you want to do with your life.
That's amazing. Um, was there a specific moment or animal that made you realize you wanted to be in the field?
Um, I don't think there was a specific moment. I think that growing up, I started out with just like dogs and cats. My mom was like a dog person for sure.
Yeah,
Um, and um I don't know, I didn't really have like a specific pet that inspired it. I was just like always around pets and always really interested in animals and just like having a vested interest in like wanting to help them to be really involved in like some sort of animal care field,
yeah.
which is what I've done for quite a few years now.
Well, for all the people who don't know, what is a veterinary assistant and
Yeah.
what do they do?
Yeah, so a veterinary assistant is basically like an animal nurse, is the best way that I can explain it to someone who doesn't know what it is. So
Mhm.
what we do is we assist the doctor in doing exams. So we'll hold animals. We learn like basic safety kind of restraint techniques for
Mhm.
efficient, quick exams. We administer vaccines, we administer medication, we do phlebotomy on our animal companions, which is blood draws collecting lab samples to send out to make sure that they're healthy.
Nice.
We do a lot of kind of like anesthesia monitoring where we fill medications for all of our like animal friends when they need it. Um, we do a lot of client communication and client education. Um, Lots and lots of things like that. So it's our job is pretty big, pretty vast. It's got a lot of responsibilities, but it's really worth it. And once you get into the swing of things, it's just something that comes like really naturally to you once you're comfortable with it.
That's amazing. Yeah, you're definitely someone who I've seen personally work, and your skill set is immense. Are you a dog person or a cat
Thank
person?
you. I This is such a hard question for me because I have both at home right now.
Okay.
I think that if I had to make a decision, in a very close like race between them both, it would definitely be I think a dog person.
Got it. W- Explain to the people what a typical day or night shift looks like for you.
Yeah, so currently I'm working day shifts. I'm also in school. So I work a very like light schedule right now, but when I'm working full time, a full day looks like anywhere between like it depends on how long you need to be there. Typically
Yeah.
when you're doing GP, which is general practice, it's an 8-hour day.
Hmm.
Sometimes there are times where you do have to stay later or come in earlier, based on patient needs, based on doctor needs, whatever is needed in that moment. You can't really tell. But you'll, depending on your duties for that day, what my day kind of typically has looked like. Sometimes you're just assisting in rooms, so you're setting up rooms for your doctor, you're making sure that your patients have like a clean room, you're getting a full history with their the pet owners, making sure you're presenting your patients to the doctor. On something like a surgery day, surgery techs get there a little bit earlier to kind of get the chart all prepared, check in surgery patients early so that they're ready and they have all of their vitals taken before the doctor gets there. Setting up surgery to make sure it's all clean for the procedure that is going to be performed that day. Making sure that all of the patients are medicated, they have like a catheter in, your fluid bags are all set up, the tools
Wow.
are clean, things like that.
Wow, that sounds like a lot of detail in what, an 8-hour shift. Well,
Yeah.
do you prefer a general practice setting over an emergency setting? What are some of the differences?
Yeah, so I don't really have a preference. Some of the differences look like general practice is more straightforward as you can be in veterinary medicine than an emergency hospital is.
Hmm.
I think that I use the term straightforward very loosely because even in general practice, you'll have some things that you're not expecting. Sometimes, if the doctors have um, the capacity in that moment or on that day, they will take some emergency cases, especially if it's a patient that they're familiar with and they're able to triage and stabilize at a general practice hospital.
Yeah.
Generally, an emergency hospital, the shifts are very different. You will be working like night shifts. It's not typically just an 8-hour shift. It can be anywhere from like an 8 to 12-hour shift. It can be somewhere in between that. You might be
Hmm.
working the night shift. You might be working the early morning, the middle of the day. It just kind of depends. But there's typically in an emergency hospital some specialty services offered as well, such as like cardiology, neurology, internal medicine, radiology. General practices don't typically offer services like that unless they have like a pretty large hospital
Yeah.
and like a large staff.
Got it. Um, what has been one of the most heartwarming cases you've experienced?
Um, Let me think about that.
Or do you
um,
have, on the flip side, do you have a case that really like tugged your heart in a in a in a way that made you feel sad?
yeah. So I think that there's a lot of both cases in a field like this. I would say we've had a lot of owners who go above and beyond for their pets that
Mm,
they've had for a long time. In a lot of cases, you'll see some of your senior patients become ill towards the end of their life,
yeah.
which happens with humans as well. But things like cancer or kidney disease are kind of like a slow way to go, but you'll see owners who persevere and they do everything that they can for their pets to keep them comfortable and healthy until it's the time to let them go. Um, we had we had a case at actually at Irvington
Yeah.
of there was a family with two golden retrievers that they had for a very long time. They did everything for them. They took such great care of them, and unfortunately, both of them did end up getting cancer later in life. And they did everything they could. They had a specialist.
Mm,
They had uh, I believe it was at Sage that they were going to. They were getting chemotherapy and seeing their specialty doctor there to get it treated. And then I think they knew that when the time was right, they did let them go at the right time. So I
yeah.
think that was one of my sadder cases that I remember.
Mm,
On the flip side, recently at my current clinic, we had a tripod dog. that she had a bilateral CCL tear, which is her cranial cruciate ligament tear, on both of her back legs, which obviously as a tripod she relied on very greatly to get around.
Yeah.
Um, she needed a specialty surgery with our mobile orthopedic surgeon, and it's a very expensive procedure, obviously, because it's a specialty surgeon, and the community rallied around this man, who this is his heart dog, and he just knew a lot of people from work and from like his life that donated to pay for her procedure, and she's doing beautifully now. Both of her knees are back to their prime state. She's living a very happy, pain-free life now.
That's so amazing. That's a wonderful story. And it's those stories that
Yeah.
really, really move you and just leave you feeling fulfilled.
Yeah. For sure. For sure.
Yeah. What are some surprising things that people don't realize you need to know as a vet tech?
Yeah. Um I think that a lot of people assume that our job is easy per se. I think that's like a big misconception, and it's not. You do get your days where you get to like play with puppies and kittens, and you get to see like new patients there for their first visits, establishing care.
Yeah.
But there's also lots of like heavy lifting, lots of you can't really talk to animals the way you talk to a person to understand why they're angry or upset or they're hurt or sick. So a lot of the times animals will react in the way that animals react, which can be not so nice. There is always a risk of like getting bit, getting scratched, things like
Mhm.
that. So you just want to keep that in mind, that animals are different than people, and there's a there's a certain level of patience that you have to achieve,
Yeah.
to be able to work with them.
Yeah.
And then you are also, just despite the fact that you are like a an animal nurse, basically, you are still working in very close proximity with owners, with your teammates. So you have to be able to have kind of human connection ability to
Mm.
like speak respectfully to your teammates, discuss things in a way that clients and owners understand, and kind of make it easier to for them to learn and to understand the level of care that their pet needs.
I love that you said that, and that's something that a lot of people need to realize, that just because you work with
Yeah.
animals doesn't mean you are not working with people anymore.
Yeah, exactly. Because you do. You have teammates that rely on you and that you have to rely on, and you have
Hmm.
to be able to discuss with like pet owners, what their pet needs at the end of the day and how to properly care for them. So there is a lot of human interaction in this field, despite what people may think.
Yeah. What are your goals for the future? Any dreams or specialties you're pursuing in the field?
Yeah, so I'm not pursuing any specialties as of right now. I am in school right now to get my bachelor's for animal science, and then hopefully go on to veterinary school, actually. So
Oh,
that's my dream
congratulations.
right now.
Yeah, that's so amazing. It's just been, I mean, just for everybody to know, I met Olivia at Irvington Pet Hospital, which is the hospital she spoke about earlier. And she was one of the top nurses in the hospital. And I mean, your skill set and passion was apparent from the start. And I really, really admire and appreciate the work that you're doing and you continue to do in the field. Um, yeah, I mean, guys, if you ever run into Olivia, just know that you're in the best hands.
Thank you. I do. I think from the moment I started this job, I knew that this was what I wanted to do, like with the rest of my life. Like there's nothing else that I've wanted to do since then. So
Hmm.
it's really fun and rewarding when you find something you're passionate about and you know what you want to do with the rest of your life. So I appreciate that, but it's a lot of fun for me. I think there are hard days for sure, but it's really rewarding.
Yeah. Well, what do you like to do in your free time when you're not saving animal lives?
Um, right now, I do some volunteer work. I'm getting animal hours for school. Um, I do like to go to the beach and go hiking a lot in like my area of town, which is like the Gilroy area right now. I'll
Yeah,
take my dog up to places like Mount Madonna or down to Santa Cruz at some of the dog friendly beaches. Um, I think now that the weather is getting nice, the hikes are going to be a little bit better, but like a rainy day cold hike is one of my favorite things to do for
that's
sure.
amazing.
There's lots of like banana slugs and salamanders to see during the rainy season.
Well, that's amazing. I really appreciate you coming on and
Yeah.
sharing your knowledge with us and just speaking to the people and spreading awareness. This is what we're doing right now. We're just on a mission right now to spread as much awareness as we can to what it really looks like to work in the animal field,
Yeah.
and just highlight veterinary professionals like yourselves because the work that you're doing is so essential. And continue to move on. I mean, you got a friend in me. If you ever need anything, reach out. And again, ladies and gentlemen, if you run into Miss Olivia, say congratulations. Bring some snacks for her and some goodies. She's the best of the best.
Thank you. I appreciate you, Ryan.
No problem. Well, ladies and gentlemen, thank you for joining us for this quick segment of working and highlighting our veterinary professionals. We'll talk to you guys soon. Thank you.
Bye.
Hey guys, this is Ryan from Athletic Conceptual Training. We're serving the Livermore area and we really want to partner with you. Students, if you're ready to get better in basketball, volleyball, tennis, come and check us out. Look at our Instagram. We have a lot of content and we got more coming. We're one of the fastest growing company in the Bay Area and there's no other place to be. Parents, if you really want to unlock the potential of your student athlete, come and partner with us. Or if you yourself want to come out and get some training with Coach Ryan, don't hesitate. All you have to do is click the link below. Unlock your fullest potential. Be ready. Get up, act today. Let's see you soon.